Welcome to our Plymouth COVID-19 update for the town of Plymouth. I'm Steve Triffletti, your Plymouth Town Moderator. We're here each Wednesday at noon for this update, which is update number 87. We're nearly a year into these broadcasts. This forum is brought to you live by PAC TV at Comcast Channel 15, Verizon Channel 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. For questions during today's forum, please email us at plymouthinfo@pactv.org. We've already received 2 questions for today's panelists. These forums can be replayed at pactv.org/Plymouth. Today's participants joining Ken Tavares, Matt Muratore, and me include Dr. Mark Wilson, also Erik Cioffi, Stephen Xiarhos, Stephen Cole, and at this time, we're going to begin, as we do each week, as we welcome back the chair of the select board for the town of Plymouth, Ken Tavares. Welcome, Ken.
Thank you, Steve, and good afternoon to everyone. I have a couple of items that I'd like to pass on to those that are watching, and that is that the Veterans Vaccine Clinic that was going to be held a week ago has been rescheduled to this Saturday, February 27th from 10 to 1 p.m. at the Plymouth American Legion Post 40. Remember, you must be at least 55 years old, must be enrolled in a VA health care, and if you have all of that ahead of time, it's first come, first served. Again, this will take place at the American Legion Post 40 building on Saturday, February 27th, 10 to 1 p.m. Also, the bells that we ring at the end of each month to pay tribute to those that have passed from the virus will be rung again by Bill Cohane on this coming Sunday at 5 p.m. And that's at the former Unitarian Church in town. Also, we'd like everyone to know that meetings are still taking place with the state in regards to the Kingston collection site. A meeting was held today, and we're going to stay optimistic that this site will get approved. And we've had a great deal of help from the state delegation and a number of other people in Plymouth that have been working on this. So the negotiations are still ongoing, and there are discussions that are very meaningful taking place. The Board of Health today at 4 o'clock will discuss this further at their meeting. That's it, Steve. Thank you.
Thank you, and that's Kenneth Tavares. He's chair of the Plymouth Select Board. He and the other members of our panel are available to answer questions for you today. And we're going to continue now with our medical segment, and we welcome back Dr. Mark Wilson. He is Professor Emeritus at the University of Michigan School of Public Health, Department of Epidemiology. Welcome, Dr. Wilson.
Thanks very much, Steve. Today, I'd like to provide some information on new research findings that should be of interest to the viewers, and then address a few questions that have been asked. I'll start with a recent report from the National Institutes of Health that has found an additional unexpected benefit of wearing a mask. Everyone knows that masks help protect us from spreading the COVID virus to others, and also helps the mask wearer from becoming infected. And now there's a good bit of new evidence of yet another potential benefit of wearing a face mask. Turns out that the humidity created inside the mask that you are wearing may help reduce the severity of COVID if you happen to become infected. This new study found that masks substantially increase the humidity in the air that the mask wearer breathes in. And this higher level of humidity in the inhaled air could help explain why wearing masks has been linked to lower COVID severity because of hydration of the respiratory tract, which is known to benefit the immune system. And this has already been shown for influenza, where the severity of flu is reduced by more humid air. and it may be a similar mechanism that's working for COVID as well. So higher humidity appears to reduce virus infection in the lungs by promoting mucociliary clearance, which is a natural defense mechanism that removes mucus and harmful particles from the lungs. So high humidity can boost the immune system by producing special proteins as well that fight viruses. Most of us have felt this increased level of humidity while wearing a mask, but without realizing that it's actually really good for us. The results from this study present more evidence of how mask wearing is simple and effective as a way to protect ourselves as well as others from respiratory infection. And so this is especially true during the dry winter months that we're currently experiencing. Let me briefly mention another research report now. Some of you may have heard that Israel has the world's highest per capita vaccination rate. And so a recent study has shown that vaccination has not only reduced COVID disease there, but that the infection rate has also sharply declined. As of last week, Israel had fully vaccinated 32% of its population with the Pfizer vaccine. And so as a result, epidemiologists have been able to undertake a large-scale study of vaccine effectiveness in what's really a real-world setting, unlike the trials that were done before. And this one involves, of course, diverse exposures, in this case, to hundreds of thousands of people in a context where virus variants are circulating. And the draft report that's been now released, which was jointly prepared by the Israeli Ministry of Health and Pfizer Pharmaceuticals, has confirmed that the vaccine prevented illness and deaths by more than 93%. But furthermore, almost 90% of infections were prevented, including those that did not cause symptoms. So for this reason, it has been suggested that Israel could actually approach herd immunity by late March or April. Also important is the fact that the vaccination campaign occurred while the British B.1.1.7 variant was the predominant circulating strain. And so even though previous laboratory studies had shown that this Pfizer vaccine that was used should be effective against the more rapidly transmitted variant, the B.1.1.7 variant, this is a real world finding now in Israel that has fully confirmed those laboratory data. So these research results are really very good news. They don't mean that the vaccine is foolproof, and indeed some COVID deaths unfortunately still occurred even among those who were vaccinated. But nevertheless, the results are extremely encouraging because they demonstrate that infection in the population, as well as severe disease, is dramatically reduced by widespread use of this Pfizer vaccine. Let me now address a few questions that have been posed that I'll just briefly try to give some answers to. One question is, I know that the vaccine rollout is well underway in the US and new cases are beginning to decline. Does this mean that we will arrive at herd immunity soon? And what are the barriers to that? So first, remember that the principle of herd immunity has to do with the proportion of a population that is immune to infection. So when enough people in a population are immune to COVID virus, so that there's no longer the possibility of transmission or spread throughout the population, we've reached the herd immunity threshold. And even though getting to this threshold partly depends on how many people are vaccinated, there are a lot of other factors that are also very important. Remember also that people can become immune to the pathogen in one or both of two ways, either by having been infected or having received a vaccination. At present, roughly 28 million people in the United States have already been infected. So most of them are likely to be immune. But it's also estimated that 3 to 4 times as many more people were actually infected than are included in the official count. So this undercounting of infections is because many infected people don't have any symptoms and don't really ever get a test, or their symptoms are mild enough that they're never really tested, so they're not counted. It means then that perhaps 80 to 100 million people in the US may already be immune from past infection. If this is added to the roughly 65 million vaccinations already administered, that represents about 13% of the US population with at least one vaccine dose, then we may be at the 40 to 45% level of the population that's already immune through both infection and through vaccination. The recent decline in new cases is probably due mostly to social distancing and mask wearing, but some of this decline, it's believed, could be the result of increased herd immunity. Experts estimate that 70 to perhaps 90% of the US population will have to be immune in order to reach the herd immunity threshold and hence interrupt most transmission. So we still have a ways to go, of course. However, the combination of more and more people being vaccinated, plus others who are immune from past infection, means that we're really making great progress towards achieving the herd immunity threshold. And some models are now suggesting that this could be as early as July. On the other hand, this herd immunity estimate also depends on how easily the virus spreads. Very simply, the more infectious the virus is, the higher the herd immunity is that we need. So this is why we're concerned with these new COVID variants that appear to be more easily transmitted. One big question is whether the current rate of vaccination can keep pace with the increased transmission of new variants, which are becoming more and more common in the US. And this means that personal precautions, mask wearing and so forth are even more important to reducing spread. It also means that we need to speed up the rate of vaccinating people. About 1.8 million shots per day are currently being administered in the US, and this possibly could double by April as new vaccines are approved. A report in the New York Times recently indicated that if the pace were to increase to 3 million shots per day, the US could possibly reach the herd immunity threshold by even May. So very simply, the more people we can vaccinate, the faster we could reach the threshold for herd immunity, even with these new variants that are now present. And finally, there's quite a bit that's still really unknown about how long immunity will last from either infection or from vaccination. Vaccination may be needed every year for all we know in the future to keep the population immunity at a high enough level. And even though vaccines reduce disease severity, herd immunity really depends on vaccines preventing infection and transmission. And this is something that needs more investigation as well. Some experts believe that full herd immunity is not even realistic, and we ought to really just focus on reducing severity of disease and deaths, at least in the short term. But regardless, vaccination, ramping up our vaccinations is still the best way to achieve these goals. Another question that I'll briefly comment on is the following. I just got vaccinated and was told that I should get an antibody test to see if I'm protected or not. Does that make sense? So experts agree that an antibody test is not necessary after being vaccinated, and it can actually be misleading, unreliable and misleading. As the chair of the Department of Immunology and Infectious Diseases at Harvard, Dr. Sarah Fortune said, don't try to second guess the vaccine, just get vaccinated. The CDC, in addition, has discouraged antibody testing to determine whether or not you're immune after being vaccinated. Both of the current vaccines that we have available in the US, the Pfizer and Moderna vaccines, are shown to be about 95% effective against severe disease. So basically they work. And in addition, the antibody tests do not necessarily test for the type of immunity that the vaccines create. These antibodies are really only a part of the full immune system and the way that the vaccination protects you. So these typical antibody tests will not detect, for example, T cells or B cells that are also part of your body's defense ability. So you may actually test negative on the antibody test, but that does not mean the vaccine didn't work or that you're not protected. The vaccines are effective and safe, and antibody testing following vaccination is not useful. Finally, one more question. My mother had COVID a couple of months ago, and she's worried about being reinfected, particularly now that the new variants are starting to circulate. Should she be concerned, or is she likely protected from her past infection? This is a complicated question, and evidence is still being gathered, but the findings that I just reported a few minutes ago indicate that there is protection against at least one of the current variants. And researchers have suspected that some people could be reinfected with the new variants, but data so far really indicate that this is extremely rare. So generally speaking, disease risk, of course, depends on many factors, including the quantity of virus that actually you are exposed to, whether it lands in your mouth or in your throat or is breathed deeply into your lungs. Other factors such as age, pre-existing conditions, and so forth. And these are the same factors that still are important if you're exposed to a variant after recovering from a previous infection. But evidence really shows that this second exposure, with that exposure, the risk of reinfection is much lower than for the first exposure. And reinfections are very uncommon because you have immune cells that recognize components of the pathogen from that previous infection, even if it is a variant. So we should not focus on these rare events like reinfection, even if they occasionally do occur, and there's no evidence that symptoms are more severe or deadly. Again, get vaccinated as soon as it's your turn and keep wearing a mask for now. I'll stop there and be happy to answer questions later on.
Thank you. That's Dr. Mark Wilson. He and the other members of the panel are here to answer your questions. Please go to PlymouthInfo@pactv.org. We're now going to go to our education segment, and we welcome back Plymouth Public Schools Assistant Superintendent Erik Cioffi. Welcome, Erik.
Well, Steve, thank you for having me. It's been a challenging time, obviously, in education, and one of the, I think the key words that has really kind of resonated with us is adapting. Since back in last year in March, we are constantly following and listening to the advice and the guidance from different organizations. And when we have something in place, it doesn't seem anymore for it to take very long for us to have to make a change. So we're kind of in that process right now. Just to kind of give you an overview of where we are as far as COVID-19 impact within the schools. I did a case study looking at since the beginning of the school year till February 12th, which was just the start of our winter break. We had just under 90 staff members, 87, that had tested positive for COVID-19. All of those except for 2. We did have 2 teachers that contracted COVID-19 within the school. And both of these cases were staff members that were working with a program within our schools where they know each and every day they're going to be coming into contact within 6 feet, hands-on, to support the needs of the students. So we're very fortunate that those that did test positive have recovered and they're back in school working. But the other 85 had all taken place outside of the school. With that, we've also had several staff members had to get quarantined. Again, some were within school, just due to their proximity with some of the programs. But the majority were outside of school. So we've had 311 staff members that were impacted. Some of our staff members had to be quarantined on more than one occasion. So it's not a true number of how many actually each time. As far as students go, we've had 329 students that have tested positive since the beginning of the school year. There have been no reported cases or any direct link where a student had transmitted or became positive because of in school. And we have had to quarantine over 1,800 students. Again, some of those students have had to quarantine on multiple occasions. So that's kind of where we're at with the full numbers. It breaks down percentage-wise that 6% of our staff have tested positive at some point, and about 4.5% of our students as of February the 12th. One of the things that we wanted to do was provide a way for us to do some surveillance testing with our families and with our staff members here at Plymouth. So this about 3 or 4 weeks ago, Dr. Campbell had been fortunate enough to purchase 2,500 surveillance test kits that we were able to make available to our students and staff. We had about 300 staff members pick them up prior to the break. This was not a mandated requirement. This was just something available for those members that wanted to have a test before they returned after the winter break. And we had about 200 students that had picked those up as well. So about 500 we gave out on that first push. And then we'll have those available for staff members between now and obviously the end of this year. We had 283 of those that were tested at the site in New Jersey, and only 2 had come back as positives. Both of those cases, the staff member and it was one staff member and one student had come back. They were asymptomatic, but we were able to put them under quarantine uh, before we even stepping foot back into the school. So very low number there. And like I said, those will be available going forward for our staff and for students. One of the big things we talked about last time I was on was our change with the DESE guidance on expectations for students in the classroom having a live contact with a staff member. We've been following the hybrid model, so there are a couple days each week where students were working independently at home. So we've made those adjustments, adapted once again, and worked very closely with our collective bargaining units to, to make sure that all of those needs are being met of our students. So we've been rocking along there. Then on February 6th at our school committee meeting, our school committee had a lot of conversation about establishing a plan to consider a return to school for our students. A lot of things have to happen in that time frame. We have to we do what we call a pressure test, where we would make sure that desks could fit into the classrooms with the 3 foot distancing instead of the 6 foot distancing. What would the lunch time look like? How are we going to feed students? Where are they going to travel through the halls, and do we have the staff to monitor? So this isn't something that could just occur overnight. We have to reestablish what the classroom looks like. And so those conversations started having taken place on the 6th, and they really wanted to evaluate some areas, one being transportation. We've talked about this before. We've had a lot of limitations with getting kids to school through transportation because the capacity we could put on the bus. We also wanted to establish a timeline where we felt like vaccines were going to be readily available for our staff. So that was going to be a consideration. We wanted to start evaluating our outdoor space, how we could utilize that. We understand that, New England weather can be unpredictable at times, but if today's a beautiful day, I've looked across at Nathaniel Morton, and it's great to see the students outside, spaced appropriately, and spending a lot of quality time outside. But that obviously can't happen every single day. And then our last area would be, what's that positivity rate looking like, not only in the community, but within the schools? So that was a baseline conversation that they were having. We started rolling that out. We shared that with our families and our staff members on February the 8th. And then within just a couple days, transportation DESE guidelines came out, and they relaxed our guidance on capacity on the buses. So that certainly was not something we had anticipated at some point, that there might be some adjustments on allowing the number of students to ride a bus, but that came out a lot sooner than we ever anticipated. So that kind of checked the box there as far as it being doable for us to return. Then recently, yesterday, we heard, well, I guess we'll step back. Monday, we had our school committee meeting, and because of these conversations, you can imagine there's a variety of opinions, and we had several members join us at public comment, sharing their support of earlier return, and we've had those that are concerned about an earlier return. So again, we're going to be evaluating all of the data that we have um, as we go forward, and we're gonna do those pressure tests. Yesterday, we got notification that there's a big push from our commissioner and from Governor Baker about students returning as of April the 1st. We do have a meeting today, a Zoom conference call with Commissioner Riley, with Desi, to have a conversation about what that would look like. So again, we're adapting as much as we can. We want to provide the optimal learning environment for our students in the safest possible way for our students and staff. And we have to make sure that our building is ready to handle students coming back. And once we have those things in place and we've um, worked out the logistics with our buildings and had more conversations with our school committee, then we as Plymouth Public Schools will be able to share what our plan will be as far as any type of return for this school year. The vaccinations obviously is a big piece for our staff members. We're obviously very hopeful that in the next couple of weeks we will have started our first round. I know that Dr. Campbell is working very closely with Brewster Ambulance as they're trying to become approved to be a super site distributor. We have the facilities that we're willing to utilize so that we can make this happen at a pretty quick pace. I do want to just point out, because this has been miscommunicated or misunderstood at different times, but we are not requiring that all staff members have vaccinations. We are making it available as best we can once it rolls out, and that'll be up to those individuals. But we feel like once that vaccine process starts, we'll have a better idea of how many actually go through that vaccination process. So there's a lot of unknowns at this point, a lot of conversations. We've continued to have the same conversation since last summer on what we want to do with our students. We know that we are never going to be able to be a 0% chance of ever picking up not only a COVID-19, but any dangerous infectious disease in the schools. But what we do know is the risk is low in schools, and there is a growing concern with our students' mental health and their academic achievement. So we have to find that balance. So I'll be available as well to answer any questions that come in. And again, thank you for having us on today.
Thank you. That's Erik Cioffi. He is the Assistant Superintendent for Plymouth Public Schools. He and the other members of the panel are available to answer questions. We've already received a couple of questions, but we're now going to go to our business segment. We're going to begin with Stephen Cole. He is the Executive Director for the Plymouth Regional Economic Development Foundation. Welcome back, Steve.
Hi, folks. Glad to be here. I just got a text from my sister, and I'd be remiss if I didn't say that my sister Catherine is a huge fan of Rep. Steve, and she asked me to say hello to him. She was recently at the Polar Plunge. I think it was on Friday, but she did tell me that you didn't jump in, Rep. She jumped in, but you didn't. We'll get to that later, though. I wanted to inform everyone that we recently saw some releases in economic data, what they call the mass benchmarks. This is a pretty important piece of well, it's a periodical, frankly, but I look forward to this particular release regularly because it gives us some of the best information we have on the performance of the Massachusetts economy. I read it so you don't have to. I typically don't read my notes. However, I will be reading these only because they're important information. I want to make sure I communicate it correctly to you. First and foremost, in the fourth quarter of 2020, the Mass GDP increased at a 7.9% annualized rate of growth. In the third quarter, both the nation and the state expanded at the fastest pace on record in history, with Mass GDP increasing at 33.1% and the US GDP increasing at 33.4%. Payroll employment in Massachusetts also grew at a 7.8% annualized rate over fourth quarter as compared to 5.2% rate for the US. In the third quarter, employment at Mass grew faster than the nation, expanding at 29.5% in Massachusetts compared to 23% in the nation. Consumer spending in Massachusetts also stayed strong. In the fourth quarter, its estimated growth of 6.8% on an annualized basis. And on the third quarter, that was when we started to see some of these restrictions relaxing. We saw people back out into the restaurants. We saw an increase of 85.6%. So that tells you, in fact, how far down we were. We were playing catch up to the nation in that growth trajectory there. And then on top of the 85%, we saw almost a 7% increase in the fourth quarter. The average estimate of US GDP growth in the first and second quarters of this year from the Wall Street Journal survey of economists says that 2.2% increase in the first quarter and 4.9% in the second quarter. Massachusetts is on par. So we should see positive growth for the next 2 quarters in Massachusetts also. Something I typically like to share with folks, though, when I come here is unemployment rates, because it's a little bit telling. It doesn't tell the whole story, but it does tell you something. Mass wage and salary growth in the fourth quarter was very strong, expanding at 26% annual rate. Wage and salary income in the fourth quarter exceeded that in the fourth quarter last year at 2.2%. Okay. Now, one of the things I shared last time I was here was unemployment rates and how seemingly significant we saw the shift. I'll hold up here a bit of a graphic so you can see. The top map was as of the worst of it in May. The bottom map was as of January 23rd this year. The scale is different, however, and I want to tell folks that right now Plymouth is looking at 3.9% unemployment. We had a high unemployment of 18.5% in May. There was a seismic shift, though, in the labor market. That much was clear. And I want to tell folks that the labor market is weaker than the unemployment rate suggests, since people who drop out of the labor market or the labor force do so partly because they cannot find a job, right? Unemployment is measured by people who are in the labor force looking for a job. Excuse me. The benchmarks report tells us that 175,800 people in the Commonwealth have dropped out of the labor pool. That simply means that at December, this time last year, we had almost 200,000 more people in the labor pool employed than we have now. That's a 3.4% change in our labor pool. So I'll reserve some comments later on, but I do want folks in the interim period to look up a Worcester Business Journal article called 2020 was the perfect year to start my new business. And I can already tell you guys know where I'm going when I come back and I do my repeat segment. Thanks, Steve. Appreciate the opportunity to share these numbers.
Plymouth Regional Economic Development Foundation. And Steve, you gave me a good segue for our next guest. Today we have 2 Plymouth State Representatives. We're going to begin by welcoming our newest, recently elected in the fall election, Representative Stephen Xiarhos. He represents the town of Plymouth. He was elected from residents in Precinct 9. And Steve, we understand that you haven't been polar plunging, but we do know that you have been responding to the pandemic and COVID-19. Welcome to our presentation. And you need to turn on your, unmute yourself, Steve. And we're not hearing you yet. This is Representative Stephen.
I think he has his phone on that's muted. That's why.
So Steve, if you can try to unmute your phone. So this is Representative Stephen Xiarhos. He is a state representative, and he is representing the town of Plymouth, along with Representative Matthew Muratore and Representative Kathleen Lenatra. And Stephen, if you can, I don't know if you can unmute yourself with, we can see your video. And if no, we're not hearing him yet. So we're going to go to Plymouth State Representative Matthew Muratore while the studio works with Representative Xiarhos. So Matt, we have also a couple of questions I'm going to throw to you. The first from viewer Barbara, who says, why are there no sites in Plymouth to get COVID shots? Also, viewer Steve with a similar question. He's saying, I'm wondering why the Scusset Beach parking area couldn't be a local vaccination drive-through. Representative Matthew Muratore, welcome.
Hey, Steve, how you doing? So let's start with that first. And I say this repeatedly on every show. The goal is not to have every community have their own vaccination site. If that's the case, we will never get the vaccinations out as quickly as possible. The goal is to get the vaccinations out as quickly and as efficiently as possible. The super sites are the areas that get the majority of the vaccines on a weekly basis. So as we discussed, at this point, the federal government on Thursdays gives us an allotment of around 120 to 130,000 doses. A good majority of those, more than 50% of those, go to the 6 super sites. And then the rest go to the smaller sites throughout. There are 170 sites throughout Massachusetts. Several of them are part of the federal program. CVS, Walgreens, part of a federal program, nothing to do with the state program. So that's the reason why you don't see one in every community. The closest one to us, the closest regional one to us at this point is the Marshfield Fairgrounds. That will do about 750 to 800 doses a day, whereas the larger sites like Gillette will do about 3,000 doses a day. So you can see that the difference in those. And the reason is because of supply and demand. We just don't have the supply to get everyone vaccinated that we need to get vaccinated. In this phase where we're trying to get folks over 65, there's about 1 million people trying to get vaccinated. And if you're only getting 130 a week, you can all do the math to figure that out, how you're not going to get everyone done in 1 week. And it's going to take some time to do that. Now, the good news is, as we receive more vaccinations from the federal government, then more sites will be open. And as Chairman Tavares talked about, we have been working as a community with the Kingston community to actually open up a regional site at the Kingston Collection. So that is on the table at the administration's office with DPH. So they know that is a place to do it, but you need vaccines in order to open these places up. So we are hoping by mid to late March. We just heard that the federal government is going to be purchasing another 220 million vaccinations from Pfizer and Moderna. So we're hoping to get a larger amount of vaccinations by mid to late March. This phase that we're in for the over 65, we project that we should be able to get through this by mid-March, and then we can start the second part of phase 2, which will include, as Erik was talking about, the teachers. So that will be the teachers, early childhood folks, people in grocery stores, et cetera. So that is the goal. Every week we seem to be getting more and more vaccines from the federal government. And as we continue to get more, you're going to see more sites open. So I hope that kind of answers the question at this point. And we get that question a lot, and it's a good question. Some other local areas you can go to is the Big Y, Halifax, Stop and Shop, the Middleborough, Hannafords, and I know on the Cape, and if we can get Steve on the line shortly, there are 9 sites on the Cape as well. Again, there are a lot of small sites, so you're better off trying to go to these super sites to get your vaccines because they're going to have more plentiful vaccines available. Now, one of the other things that we get, questions we get asked about is the website. And this has been a major disappointment, the website. It's controlled by a company out of, I believe it's out of Maryland, Steve. And I think 21 other states are using it as well. So I know the administration is working with this company to make significant changes to the website to make it more user-friendly than what it has been. There is now a digital waiting room in there, but there are going to be more changes that will be made over the next 2 to 3 weeks as well. So you'll see more improvements to the website coming shortly. And to give you some the numbers of the doses of vaccines that have been given to date, right now Massachusetts ranks in the top 10 of distribution of vaccinations to the citizens per capita in the country. We are now at 85.4% of vaccines being distributed to folks in Massachusetts. Right now, there's been, as of yesterday, 1.3 million vaccinations have been shipped to Massachusetts. Another 427,000 have been shipped through the federal program. So that's a total of 1.73 million vaccinations have been shipped, and we've given out 1.476 million vaccinations. First doses, a little over 1 million, and second doses, 415,000 doses. So as you can see, we really are ramping up. We have the capacity, we have the sites, we'll be adding more sites to get this out as quickly as possible when we're starting to get close to 1 million vaccines a week. We're going to be in a great position to get this out quickly. And we do expect to start phase 3, which is the general population, sometime in April. So I think that we're still on track for that. So that's good news coming out of Washington. And just one last thing, just to touch upon the testing. Testing is dropped to 1.89% for the 7-day positivity rate average. Confirmed cases are over 542 pandemic started a year ago. We've given out 15,662,000 tests. The active cases of those with COVID-19 in the Commonwealth right now is 34,000. Back in the beginning of January, we were at almost 80,000 at that point. So you can see the testing is still happening. The positivity rate is going down. Hospitalizations have dropped to below 900 now. ICU, there's 225 folks in the ICU, and 147 of those folks are vented. So you can see that the vaccines are going up, and the COVID-19 is going down. So we are heading in the right direction. So that's the update, Steve.
Thank you, Plymouth State Representative Matthew Muratore, and he's reporting on vaccine sites. And I can report to you, my friend Steve, his wife Hazel, they are Plymouth residents. They were at Marshfield earlier this week, successfully got their shots. And I had another friend at Gillette yesterday for his first shot, another one going there today for his second shot. So there are available slots for the shots. And at this time, we can see on our video, once again, Representative Stephen Xiarhos. Steve, we understand that you are involved with a food distribution plan. Tell us a little bit about that. And we're still, Steve, not getting your mic. So we'll try again. The studio will work with you, and if not, we'll bring you back next week. But we'll come back to Representative Xiarhos, and what we're going to do is we're going to go now to Dr. Mark Wilson. As we circle back to our panelists, we're going to have each of them again talk to us about what they have to offer to us additionally for their closing thoughts today. Dr. Wilson.
I was pleased to hear that even though school cases are appearing, the surveillance and testing response processes are really working as planned. That's impressive. And so in addition to this, even though we're still all anxious to be vaccinated, at least most of us, of course, early on, that was the opposite problem. We were worried that people would not be seeking vaccine. But in this case, now we have more sites that are opening, more vaccines that are becoming available, cases are declining. I think this is all good news. And frankly, I'm very encouraged. I know that many of us are frustrated that we can't get vaccinated right away. And yet, even though once we're vaccinated, we'll have to continue wearing masks for a while into the future and socially distancing. But the good news here is that things are moving in the right direction. Thanks.
Thank you. And that was Dr. Mark Wilson. I understand that we may be able to now go back to Representative Stephen Xiarhos. So we'll do that, bring him back, and we welcome him. He is a state representative for the town of Plymouth. We have 3 of them. And Steve, welcome.
Thank you so much, everybody. Good afternoon, Plymouth. It's been quite a day. I'm very impressed watching you and listening. And you got me on the plunge. Yeah, that was a rough day on Sunday. It was beautiful. We raised a lot of money for veterans. And I'll be doing it again, this time going in the ocean in March to help the Sandwich Little League. But I'm proud to be a state representative. I have part of Plymouth. We have Matt Muratore, Kathy Lemaitre, and a great team. But today I was here to mention briefly a great program that we're doing all over the state. It's called Farmers to Families. And I would love to work with Matt and Kathy and the board and the schools to bring it to Plymouth. And what it is it's a federal program. It's basically we could bring 1,000 cases Each case has 32 pounds of fresh food from farms all over America, and it costs no money. So we do it every Saturday in Xiarhos, where we have a truck sitting there with 20 or so volunteers, and people drive up and we give them a smile and put a case of fresh food in their vehicle, and they drive away. We do it also in New Bedford. We do it in Eastham. We do it all over the state. It's a voluntary thing that I have a passion for. It's part of the Massachusetts Military Support Foundation, which I'm a volunteer on. And you may have seen it on the news yesterday. We actually sent 2 tractor trailers full of food to Texas to help them. So we would love to do it in Plymouth. It costs nothing. The only tough things are you have to have a group of, let's say, 10 to 20 able-bodied people that would be there. Let's say if it's a Saturday, a truck would show up around 8 o'clock in the morning. It would unload 1,000 cases of food on pallets. It's all fresh food, so it has to be refrigerated. And then the people would drive up, and you would put it in their vehicle and they would drive away. Some people will say, well, they don't need it, or they don't deserve it, or there's a stigma sometime. We try to call it food security, not food insecurity. The food is paid for by the federal government. It helps keep farmers in business during this pandemic, and it will give people of Plymouth food. And if they don't need it, they can give it to a neighbor, or if they can accept it and use their money that they would spend on food for gas or to help pay for a bill. So it's a program we would love to bring to Plymouth. It could be every Saturday morning. It could be every Thursday morning, whatever you'd like. And we would bring it to you. We'd help you do it. And we just need a commitment on where it would be, what location, and with volunteers who are willing to do it, whether it's, raining or snowing or hot. We've done it every week since March, so almost a year. And it's very humbling to be able to feed people in the middle of a pandemic. And it's something that is very good for the volunteers as well to do. So we wanted to take a few minutes to tell the town of Plymouth about it. We've spoken to some people already in the Rotary. We've spoken to the superintendent of schools. He loves the idea. And we're looking at Plymouth North High School as the spot. And we're looking at, a bunch of high school kids helping as well. So that's the general idea. It's called Farmers to Families. We'd love to bring it to Plymouth. We did a small version at the Plymouth Hospital, BID Plymouth, to thank the healthcare heroes. We fed 500 healthcare heroes in the parking lot. They drove up, picked up their food, and we gave them a thank you for all the hard work they're doing in the middle of a pandemic. And we would love to do it more in Plymouth.
Thank you. And that's Plymouth State Representative Stephen Xiarhos. He's here also to answer your questions. We're going to go back to our panel and continue. Erik Cioffi, he is the Assistant Superintendent of Plymouth Public Schools. Erik, what's a takeaway today for you as we've listened to the other members of the panel?
Well, I too am encouraged with the process of the vaccinations becoming more and more available. That's obviously been a huge thing for not only our teachers, but all of our support staff that support our students. And I know our transportation drivers that get our kids to and from school, they're coming up on that same time frame. So it's good to hear that we're going in that direction, that we'll have more available. I think the big thing that I can't stress enough is we've had lots of conversations throughout the year, but they're starting to really pick up steam. And there seems, I've mentioned this word before, adapting. We're going to continue to adapt. Our goal from day one has been to return our students to school. We want to just make sure we're doing it in the most effective, efficient way, and keeping safety is a priority for us. We feel like the numbers are are trending down. I think we've shown throughout the year that the school transmission rates are low. It's a safe place for our students and staff. We just want to continue to put the measures in place that we have. If we have to adjust our seating arrangements, that's going to be that big pressure test that we talked about earlier. If we're going to go from distancing in the classroom from 6 foot to 3 foot, we have to know what that's going to look like. So a lot of conversations to be had over the next few days, and then hopefully we'll be rolling out to the community a strong plan that we can all get behind and support our students.
Thank you, Erik Cioffi. He is the Assistant Superintendent, Plymouth Public Schools. We're now going to go to Stephen Cole, the Executive Director, Plymouth Regional Economic Development Foundation. Steve, we're fortunate to have you join us every other week. And what do you have for us today?
Oh, you flatter and honor me, sir. Such an honor to be here, and I'm so glad to have this chance. I mentioned just before I cut away that there was an article in the Worcester Business Journal, and it's somewhat reminiscent to what you've heard me say over the last handful of weeks and months that we've been doing this. It is real that people in this community will not have their job waiting for them when this is all done. It's very real that jobs will expect certain skill sets that if you've been out of the workforce too long, you'll need to play some catch up. I've also told you that if you don't think that your job or the job of your loved ones will be there, create it. Find the type of job that you want to create and start your own business. The article that I cited to you is called 2020 was the perfect year to start my new business. And I told you all along that it is a good year to plan for what you want to do when this is all over. I want to pull a quote out of there. This particular quote is something that this author cited as being the thing that led her to believe that this is the actual right opportunity for her. Quote, and this is coming from Mark Cuban, however. I tell people that when I look back at 20 years, there's going to be 10, 20, 50, even 100 world-changing companies that were created right now because people had a vision for the future. They took advantage of apps and boom, they became huge companies. And we're going to look back and say, okay, there's this business reset in 2020. And there were a bunch of kids that came out and said, I have a better idea. Let's go in that direction. And it worked. He is forecasting that in 20 years, when we reflect on this, this time will have been the time when the most impactful business will have been created. One of the earlier episodes, I presented to you a list of businesses that were created over the last 100 years and what are the conditions that they existed when they were created. GM came out of a depression. Disney came out of a depression. 2008 was a huge reset. That's when we saw Netflix take off. So I don't want to belabor folks with specific types of businesses that have now seismically changed the world. But when you go back in that episode and you look at that list, almost every single business that we rely on today to help us get through this period largely started because of a complex economic crisis or a national crisis. So I just want to stress, folks, if you're home, if you're looking for a quick 5-minute read and you want a really personal anecdote for someone in the Commonwealth who took this opportunity to do something significant, the Worcester Business Journal, the article is written by Renee Diaz, and the article is called 2020 was the perfect year to start my new business. Thank you, Steve.
Thank you, Steve Cole. He's the Executive Director of Plymouth Regional Economic Development Foundation. And each week we come to you with a panel. Next week's panel, joining Ken, Matt, and me, include Dr. Philip Triffletti. He's an attending primary care physician at Beth Israel Deaconess. Also, Dr. Barry Potvin. He is the chair of the Plymouth Board of Health. For the Plymouth Public Schools, we'll be joined with Dr. Stacy Rogers. She's the Director of Special Education, Plymouth Public Schools, and once again, Michelle Brady. She is the Executive Director for the Elder Affairs in the town of Plymouth. Heather Cozby, a Plymouth CPA. Michael Jackman, District Director, Congressman William Keating. And at this point, we're going to go back to Plymouth State Representative Stephen Xiarhos. Steve, you've gotten an opportunity now to hear from all the members of our panel. This is your first time. We hope you'll come back and join us. Any closing thoughts that you'd like to share with our viewers?
Thank you. Love to do this weekly. The beautiful community, thriving. We wanted you to know who I was. We're here for you. Also, to remember the Farmers to Families program. We'd love to bring it to Plymouth. And yes, Matt and Kathy and all of us are fighting for more vaccinations not only for Plymouth, but it's basically the same story on the other side of the bridge. And to try to stay as positive as you can, and we'll get through this together.
And thank you. That is, again, Plymouth State Representative Stephen Xiarhos. And now we're going to one of our other Plymouth State representatives who's with us every week, Matt Muratore. Matt, your closing thoughts.
Yeah, thanks, Steve. Yeah, I think Steve is right. We all need to continue to stay positive. As I say every week, be curious, not judgmental, as Walt Whitman says. Black people are asking the questions, why can't we? And that's fine to ask those questions, be respectful of the answers, and that we're going to give you the facts on the show. I think some of the takeaways from this is the vaccine rollout will happen again this Thursday, 8 o'clock. There's going to be about 130,000 appointments that will be open for about 450,000 people. So you can do the math and figure out that there's going to be a lot of people that aren't going to be able to get it, but a lot of people will. Just like last week, about 70,000 people got the appointments. So encourage you to go to mass.gov/COVID vaccine website, where you can find out all the information and make your appointments. You can also call 211 as well to help you make an appointment. So continue to be positive and be optimistic, and we will definitely get through this and come out better on the other end. So we'll see you next week, Steve.
Thank you, Plymouth State Representative Matthew Muratore, and we will see you next week on Wednesday, March 3rd. Ken Tavares, you and Matt and I were back here last March. We'll be back again this coming week. It'll be March again. We'll have circled a full year with this pandemic. What do you think?
Well, I've got a number of thoughts, and it's hard to believe that it is a year ago that we started planning the program and doing this on a weekly basis. Actually, we started doing it on a daily basis in the beginning. So much has changed in that year. One thing that I didn't mention in the opening statements was that last night the Board of Selectmen approved once again outside dining in downtown Plymouth, which will be a big benefit to all of our restaurants. Also, the board had a plan put before it that endorsed two-way traffic in the downtown. So that was passed on a unanimous vote of 5-0. And I'm very anxious to see how this program will work. We know that we've been experimenting. This will be the second year, and possibly there could be some great long-term changes that come out of this after we've defeated this virus. Next week, I won't be joining you because I'm going for my second vaccination. And I can't believe that it's been a month, and I'm going back next week. But it does take persistence. I know it's tiring, and it's I guess no better word to say. It's just horrible when you're, working the site, and then you get so close, and it says, nope, start over again. I appreciate that feeling that many of you have, but it does work. It's getting better. People on all levels of government, from local on up to the federal, are making changes the best way they can. So again, it's patience. I think my biggest takeaway from today is that something that we've talked about in the past, and that is change is the only constant. And I think all of us have had to, on a daily basis, adapt ourselves to change, that no matter how much work was put into a plan, it's possibly going to change at the last minute. Just during this wrap up, I've got 6 calls coming, all related to the virus or some type of town service that may not be being made at this time. We will do this together. We will defeat it. We're on our way. Just have patience and remember, change is the constant. Thank you, Steve.
Thank you, and that is Chair of the Select Board for the Town of Plymouth, Ken Tavares. And again, we'll be here next week. We're glad that Ken is getting his second shot. Ken, allow yourself a couple days after to rest and relax. I got my second shot last week, and I was glad to have the weekend to recover. We want to thank everybody for joining us today. Thank you for your questions, and please join us next week and for future presentations as we continue to provide you with this presentation from experts and local, state, and federal officials as we all strive to respond to the ongoing challenges of the COVID-19 pandemic. I'm Steve Triffletti, Plymouth Town Moderator. Thank you for joining us, and good day.